Well, good morning. Good morning. Can you hear me? Can you hear me?
Yeah, I can hear the number.
Speaking Mike, I can hear you.
Okay.
Speaking Mike, I can hear you.
Good morning, sir. We can hear you.
I can hear the number. Mike, okay.
Dr. Mike.
Good morning.
Dr. Mike.
I can hear you.
I don't even know who's talking. Good morning, everybody.
Good morning, Vicky. This is Anu.
Okay.
Good morning, Mike.
Good morning.
Good morning, sir.
Good morning, man.
Good morning, sir.
Morning, man.
Good morning, sir.
Dr. Idris, good morning, sir.
Morning, sir. How are you, sir?
Now you are see without paying, so Your Royal Highness, Abba and Tremble. He didn't tell me that everybody is here. It is well.
Mr. Nomad.
Yes, sir. I'm trembling here, sir.
Well. Then that's why the Zoom is not working well.
You see how my head is moving.
Yeah, you are shaking the Zoom. Keep your head steady there. You are shaking the Zoom.
Yes, sir.
How are you today?
Hi, sir. Good morning, sir.
I'm very fine, sir. They don't let me sleep. Yes. Wait, is that Dr. Bola? Bola Olowu. Dr. Olowu.
Yes, I've been saying good morning, sir. Good morning, sir.
What are you doing
yes,
here?
So it's me.
What are you doing here? Who brought you here? Whoever brought you is in trouble. Good morning, ma.
Good morning, sir. How are you doing today?
Alive and well, oh.
We give God all the glory.
Yes.
And the man. Okay, I'm going to do mute. But I print to take it from them. Push page. Haruna Bako. Huh?
Are we still on?
Muted. Right, Mrs. Duke? Okay.
Nobody should come in.
Okay.
I'm 1:45.
Good morning, distinguished ladies, Your Royal Highnesses, distinguished ladies and gentlemen. We're a bit slow in starting up, but further, I want to just draw attention to a few things. You're welcome to this forum. And on behalf of International Society of Media and Public Health, on behalf of the Health Sector Reform Coalition, welcome you to this Strengthening Advocacy Capacity webinar, and we thank you for being here. To navigate us through today's event is Anurotimi of HERFON. And I hand you over now to Ms. Anurotimi, who will be navigating us through today's event. Thank you.
Good morning, everyone, and we are all welcome to this very important event. It's our pleasure to welcome you on behalf of the Ethical Reform Coalition. The International Society of Media and Public Health is very happy to be hosting this all-important occasion. Today is the landmark, especially as we strengthen the engagement and response to COVID-19 across the country. We've seen that our engagement with various stakeholders has brought some leverage. But today, this occasion of actually strengthening the advocacy capacity is also one of the key approaches of ensuring that all stakeholders are able to engage meaningfully with each other. And that is why it has been tagged Webinar on Strengthening Advocacy Capacity for Epidemic Readiness and Response, COVID-19. On the agenda, we are going to be starting first with the national anthem. We as Nigerians, we hold our country proud. Can we do the national anthem, please? And we are going to encourage all the panelists with me to please mute themselves as we pay cognizance to our nation. So we're going to be having the second stanza on the screen shortly, and we are going to recite it together. Oh God of creation, direct our noble cause, guide our leaders right, help our youth the truth to know, in love and honesty to grow, and living just and true, great lofty heights attain, to build a nation where peace and justice reign. Welcome to this event, which has been powered with support from MacArthur Foundation through the Network for Health Equity and Development, coordinated by Sector Reform Coalition, and being implemented by CHESTRAD, MedPort, and ISMPH. The event today is being anchored by ISMPH, with the virtually developed an advocacy toolkit. And on the event with us today, let me just quickly run through our key, our hosts, our guests that we have on the event. We have with us today the Royal Highness, Dr. Aliru Yaya, the Emir of Shonga, a foremost state agent. Welcome, sir. We are pleased to have you. We also have with us His Royal Highness Oba Kayode Ademepo Afolabi, Atoyebi, two of Alakomu of Akomu in Osun State. You are welcome. You are honorable. You've been a veteran journalist. We look forward to having you more. Also with us, we have His Royal Highness Alhaji Ahmed Abdullahi, the KIG of the UK Chiefdom in Nasarawa State.
Okay, I don't know that.
We also have today Dr. Idris, the former Commissioner of Health in Lagos State. In fact, we say is the veterans of all commissioner because they have been the longest serving commissioner in the country, Commissioner of Health in the country. And also a former state agent. You're welcome. We also have Dr. Omoyele, the director in charge of the special services and the diaspora unit of Federal Ministry of Health. Dr. Olowu, you are welcome this morning. And also we have Dr. Mike Ego, a veteran advocate that has been at the forefront of health system strengthening and reform in the country. Advocate and voices for health rights and health issues in the country. He is the anchor of the chairperson of the HSRC Reform Coalition COVID-19 Taskforce. We also have with us this morning the grant holder for the project. That's Dr. Emmanuel Soko, the Executive Secretary of Network for Health, Equity, and Development. You are welcome to this event, Dr. Soko. And on that note, I'll be handing over the process to, okay, yes, and very importantly, we have with us the host of this event. You cannot forget her because she is the brain behind all this whole the gathering this morning that we are having, and it's going to make a change in our space in terms of the health systems and advocacy for better response to COVID-19 without emergency systems. So we have with us Chief Mrs. Mojima Konjola, MFR, and she is Executive Director of ISMPH, and she's a core member of the sector of the Sector Reform Coalition, and she's been playing very key role. You're welcome, and thank you, ma'am, for hosting this event. And my own name is Anuro Timi. I'm the Program Manager of Sector Reform Coalition, HERFON, and I'm happy to be moderating this session. And many thanks again, once again, to MacArthur for giving us the grant to proceed on this very important intervention. Now, on that note, I'm going to call on Dr. Mike, the chairman of the Sector Reform Coalition COVID-19, to go ahead and give us his opening remarks.
Okay, thank you, Anu. Good morning, everybody. If you are not speaking, can you mute your microphone so that our listeners can hear us very clearly? Because when Anu was talking, it was echoing. Welcome, everybody, to this interactive session. The seminar on strengthening advocacy capacity for epidemic health response. COVID-19. I'm glad to be here today, and I'm happy that we're here, and I'm happy that you are there listening, and I hope you will also share your questions or make contributions, because the business of health is a collective responsibility. The Health Sector Reform Coalition and during the week of the epidemic, decided we were going to be an active participant in the national response. And so we met, over 130 civil society organizations met to say, how can we be supportive of government? This was in March. How can we play a role? How can we hold the government accountable? How can we ensure that citizens get the information that they need to get? How do we also ensure citizens' responsiveness to make sure that they are part of decision making? And that made us to start having very serious meetings to look at what areas of government, at that point, there was fear everywhere. Nobody knew what was going to happen. All we were hearing were stories of doom and all that. But we know that just for some of you who are listening for the first time, Health Sector Reform Coalition is the coalition that pushed and got the National Health Bill passed into law. It's the group that have also pushed to ensure that the act was funded. So we saw it fit and a collective responsibility to be part of the national response. And so what we did first was to establish what do you call it?
But there's something the speech I was to make was the same.
Various working groups, 4 working groups were established. One of which was advocacy. And today we are here to look at what has been done, the advocacy toolkit. We all know that if Nigeria had prepared very well, we would not have gone into the kind of frenzy that we got into. But we thank God that Dr. Jide Idris is here today with us, who was the commissioner for health during the Ebola, and Lagos State shown very brightly, not only in Nigeria, but globally for containing Ebola. And so we had something to latch on. And because of that too, the coalition decided we're going to look out for support. And that support came from both Gates Foundation and MacArthur Foundation. But the event that we're launching today was supported by MacArthur Foundation, to see how we can mobilize citizens, how we can get citizens engagement, how we can get them to be responsive, and how we can support government to do what they need to do. For instance, when we had issues about opening or no opening, we stood our ground firmly to say this is what needs to be done. Things should not open yet. People should still be kept at home, but support should be given. We're looking at various ways to make sure that citizens don't suffer. That while staying at home, they're able to get something. When we had issues with Cross River State, we stood our ground to say, yeah, Cross River must speak up, must open up. And so we have done well. So today, I don't want to talk much because we are so many of us here. We're launching the Advocacy Toolkit, and I want you to listen very carefully. It is practicable, it is scalable. We hope that everybody will adopt it, because this is the way that we need to ensure that Nigeria prepares for the next, because we don't know what will happen tomorrow. Every nation is preparing. We need to advocate for change. We need to make sure that every sector is an active participant in that change process. That is why we're here today. So you're welcome and happy listening. Good morning. Over.
Thank you, Dickie Mike, for giving us that background and telling us the journey from where the HSRC has been able to make impact in the response to COVID-19 and the journey so far. On that note, because of time, I'm going to call on the grant holder for this project. That is the Executive Director of Network for Health Equity and Development, Dr. Emmanuel Soko. Over to you, please, for your overview of the projects.
Morning, Your Royal Highnesses, distinguished guest participants. Dickie Mike has already given a brief link between the Health Sector Reform Coalition and the grant. So my role is just to link you with the grant and the various players. As he said, the grant is from MacArthur Foundation, and Network for Health Equity and Development, which you can see on the logo as NHEAD, is the grant manager. HERFON, as you know, is the Secretariat of the Health Sector Reform Coalition. So they are responsible for pulling together all the activities. As you know, health sector reform is a coalition, so they need a secretariat, they need a base upon which to operate. As Mike said, there are over 130 registered members scattered around the country. And so HERFON provides a secretariat for their activities. And so HERFON is actually the project manager for this project. And you have three main implementing partners who are like the sub grantors. And these are ISMPH, who are here hosting us today. ISMPH, you know, as International Society for Media and Public Health. And you had, they are responsible for the advocacy and partnership component of the project on which we are leading, we are sitting here today. The key deliverable which they are supposed to provide is Advocacy Toolkit, which they are going to present to us here for non-state actors in COVID, health sector actors in the country. The other key implementing partner is Medport Nigeria Limited. They are responsible for the health system capacity and integration system. We are expecting from them to deliver us a brief policy brief on the integration of the essential COVID-19 supplies into the primary healthcare system, primary and secondary healthcare system of the country, so that you don't have parallel systems trying to confuse the whole supply chain. Then the third key implementing partner is CHESTRAD, who are responsible for the citizens' action against COVID. Their own output or key outcome is a resource kit for citizens' action for COVID-19 in health and social prevention across the country. So those are the key actors and their roles on this project. You might ask, what is actually the key goal of this project? The project is aimed to support the national and subnational COVID-19 response through integration of streamlined effort by CSO networks at national and subnational levels for effective coordination of performance monitoring and penetration and consistency of risk communication as recommended by NCDC to the general public, in this case, probably the Presidential Taskforce. The project is expected to last from May to November, so we're almost rounding up, That's why the final product are coming out today from one of the key implementing partners. What are the key objectives of the project? One of them is the mobilization of greater public awareness on COVID-19, and two is developing and disseminating context and citizen-focused preventive protocols using NCDC approved guidelines. Three is provision of cut-to-fit technical support for the national response. And four is advocacy for a well-coordinated response to COVID-19. As we're all witnesses to what has been happening on social media and others, if there's no proper code, despite the efforts of the Presidential Taskforce, you could see that a lot of things were happening by various both state and non-state actors, which required effective coordination. And Health Sector Reform Coalition, as a key actor, provided this platform to ensure effective coordination. In terms of coverage of this project, which states and which local governments is it covering? The project was targeted at 3 states, and they are Lagos, FCT, and Kano. In Lagos, they're covering 6 local governments. In FCT, 6 local governments, and in Kano, 4 local governments, making a total of 16 local governments. The essence was, yes, Nigeria is big, but then trying to spread all the interventions within the 36 states and the 774 local government was almost impossible in 6 months, and the small grant that was coming. So this was supposed to provide tools and materials that can be used at the end of the project for wider use across the country. So these are the key objectives of the project and areas of coverage. So we're happy as the grant managers that things are moving well. We're waiting for the final products, one of which is this toolkit, and we hope that at the end of the project, the materials will be used not just within these 3 states, but then widely by CSOs, beyond the 130 numbers that Mike has mentioned, across the others, and even within government, to ensure that this small seed sown through this grant will now, be used effectively for health security and others, across the country. So thank you for coming, and I wish you a happy and effective contribution and deliberations. Thank you.
Many thanks for support for that well-detailed and structured overview of the project. And I'm very sure that if you don't know what this project was all about before now, the brief from Vicky Mike and Dr. Emmanuel Soko has actually given you the depth of what the coalition has been doing, and precisely what we've been doing under the MacArthur funded intervention. The next thing we'll be going to now will be the collaborative remarks. The first person to give us the collaborative remarks is Mrs. Eunice Damisa from National Primary Healthcare Development Agency. Mrs. Eunice, are you on, please, for your collaborative remarks? Okay. When she's back, we will call on her. Maybe she has some network issues. You know the way it is in Nigeria sometimes, but we hopefully hope that this will get better with time. The next on the agenda to give collaborative remarks is the Executive Secretary of Health Reform Foundation of Nigeria, HERFON, Dr. Celestine Okori. Dr. Celestine Okori, please be kind to unmute yourself and give us your 2 minutes opening collaborative remarks. Thank you. Dr. Celestine Okori, kindly unmute yourself.
Oh, sorry.
Good. You can have your voice now. Thank you.
Okay, can you hear me? Hello?
Yes, we can hear you.
Yes. Good morning. Your Royal Highness, participants, and our guests present. It is my great pleasure to be here this morning as we look forward to the adoption of the Advocacy Toolkit as part of the Health Sector Reform Coalition contribution to the COVID-19 response in Nigeria. The toolkit could not have come at a better time than now, when many citizens are already beginning to relax, and when the rate of testing is beginning to decline across the whole states of the country. And again, of course, when in other parts of the world, there is a second wave of COVID-19 that is coming up, so we can't afford to relax at this point in time. So the toolkit certainly will be very useful for our advocacy. HERFON, with its 36 state chapters and with the FCT branch, we are committed to the use of the toolkit, and we are committed to using evidence-based advocacy, which we are widely known for. Also, as the Secretariat of the Coalition, we will continue the country response and citizen action to strengthen the advocacy for health emergency response. Thank you very much. Hello? Hello? Hello, can you hear me?
Thank you, Dr. Okori, for that presentation, and thank you for your kind words, and I hope that we'll continue to do more. This is just the beginning of better things to come for us as advocates. So, Dr. Eunice, Mrs. Eunice Damisa, you are welcome. We're happy to have you on behalf of the MPHDA.
Thank you. Can you hear me?
Director. Yes, we can hear you.
Okay.
So we are looking to give your collaborative remarks on behalf of the Preparedness Global. Over to you, please.
Okay, thank you very much, Anu. And My respectful regards and good morning to our Royal Highnesses who are online, distinguished members of the coalition, and my big Oga, and everyone. I bring you good tidings from the ED CEO of the National Primary Care Development Agency, Dr. Faisal Shuaib, who would have loved to be part of this initiative today, but unfortunately he had some other national engagements. And he has asked me to wish everyone well and to let you know that he's very excited by this initiative on strengthening advocacy and looks forward to the outcome and looks at ways, especially the Advocacy Toolkit, and see where, as MPACD, as an agency, we can benefit from that tool. Personally, I'm honored to be part of this laudable project. And I must say that this aligns perfectly well with the MPACD vision for PAC in Nigeria. And since the inception of Dr. Faisal Shuaib in January 2017, we've seen a lot of transformation initiatives in the agency, and which some of us here can attest to, and which has been yielding results, including a recent certification of being a WPV free country. When it comes to COVID, we, as an MPACDA, when we had this pandemic, we took the bull by the horn, because you all know that for MPACDA, the PAC system is our purview, and the PAC is the closest to the people. So what we did as an agency is to roll out some initiative to support NCDC in containing the outbreak. The chief executive, Dr. Faisal, immediately set up in March a COVID-19 command center, leveraging on the incident management structure of the polio initiative. And with that, we have what we call MPACDA COVID-19 command center. And what we have done, you will recall that at the peak of the pandemic in Nigeria, that health workers were so scared that most ran away from their facilities. We have reports of situations where Nigerians that wouldn't have died because when they got to the PAC centers, the workers were so scared that they didn't attend to them. They were so scared of contracting the virus. So what did we do? We went and build the capacity and confidence of the health workers by training over 220,000 healthcare workers, including community volunteers, to ensure that the people are confident to come to the PAC, the workers themselves are confident to attend to the people. We didn't stop at that. We said, we also looked at our data, what is showing us. We realized that between March and April, we are beginning to have reduction in the coverage of in RI coverage, because of course, for obvious reasons, why people are scared to go to facilities. And that is expected. And what we did was to develop what we call with our partners. We rolled out what we call PAC optimization amidst COVID-19 outbreak. And with that, we're now, if you go to facilities, most facilities, you can get services in spite of the pandemic. We also embarked on a distribution of PPEs to facilities, so that as all this get towards building the confidence of the workers, so that they can deliver services. For us then, we are very happy to have this initiative, to be part of it. As I said earlier, we are looking forward to the advocacy to go. Whatever we have achieved so far in our support to NCDC to reduce community transmission of the virus, it's because we also engage in intensive advocacy at the highest level and at the lowest level. Community-based advocacy, which is often not talked about, is one area that we have really strengthened collaboration with the communities. So,
thank you so much.
I would therefore say that we are looking forward to the advocacy toolkit so that we
Thank
can
you.
operationalize as soon as possible. Thank you very much.
Thank you, Mrs.
Over.
Eunice Danisa, for that very elaborate and commitment to continue to engage and partner to strengthen response to COVID-19. And we are very happy to know that this actually kicks in with the strategic focus of the agency. And we look forward to more collaboration beyond this. Thank you so much, Anna, for that clear-cut commitment. And the next on the collaborative remarks will be Dr. Ibrahim Isa from CHESTRAD. He will be representing CHESTRAD and MedPort to give the collaborative remarks. Dr. Isa Ibrahim, please kindly unmute yourself and let's have you give your 2 minutes maximum collaborative remarks, please. Thank you.
Thank you very much, moderator. My name is Dr. Isa Ibrahim. I will be making these remarks on behalf of CHESTRAD Global and MedPort Global. Please permit me to observe the existing protocol. So on behalf of the board and president of CHESTRAD Global and MedPort Global, I congratulate ISMPH for its work in the development of this advocacy tool on COVID-19 pandemic. In a situation where citizens are not adequately involved in the formulation and implementation of policies affecting them, initiatives like this are important to get the voices of the people heard on issues affecting them through advocacy actions. With the array of media practitioners in its network and at its disposal, I believe ISMPH is well positioned to build their investigative journalism and specific skills for advocacy as opposed to routine news reportage. Advocacy messages and actions are only good and effective when you use evidence to make specific asks, especially from authorities at political and policy levels on behalf of citizens. So we are confident that at the end of this webinar, a call to action will include necessary steps for building the capacity and skills, especially of journalists, for advocacy actions through their various platforms for improving mitigation measures against the impact of the COVID-19 pandemic on the citizens. As a beneficiary of the MacArthur Foundation Fund, there is a convergence in the work of ISMPH and those of other implementing partners, including CHESTRAD and MedPort, in the collective support to the national response to COVID-19 pandemic. Thank you and happy deliberations.
Thank you, Dr. Isa, for that collaborative remarks, and we really look forward to the entire output of these interventions working together. On that note, I'm pleased to call on the host of these events and the one that has actually led the process of developing this advocacy toolkit to tell us why do we really need this toolkit. Well, what is really different about this toolkit and the changes that this toolkit is expected to deliver on. On that note, I'm pleased to call on Chief Mrs. Mojima Controller, MFR, to tell us and take us through the COVID-19 system rescue and citizen action, tagged Y Advocacy. Chief Mrs. Makonjola, veteran journalist.
Thank you very much, Anu, and your Royal Highnesses, honorable commissioners, and of course, directors here present. Very great advocates. Am I on?
Yes, you are on.
Thank you very much, Anu. Again, I'd just like to place on record Your Excellencies, your Royal Highnesses, Your Royal Highnesses here that have honored us, great advocates, members of the coalition, my colleagues, journalists that are here too. I need to recognize you because you will disseminate and ensure that this is amplified all over the world, I dare to say. And of course, our members of our panelists who have been here as early as 9 a.m. because of the commitment that they've shown. I thoroughly appreciate you and Deacon Mike, that I had to wake up very early. He's in America. Dr. Isa, who is also having to keep a night vigil. My sister, Dr. Bola Olowu, thank you for keeping, and Dr. Jide Idris, who certainly had to leave one meeting to be with us today. I appreciate you. Now I'm going to talk about my royal fathers. I can only thank you enough, and thank you for what you're doing as we move health agenda forward. And so now let me just quickly go to my one pager, because we have we have an expert who would able to dissect why we're all here today. But quickly, opportunities for strengthening our health system abound now, even with diverse, what I call health demoting conditions, crime, natural disasters, man-made disasters, and incidences of diseases, communicable and non-communicable, lifestyle diseases, wars, insurgencies, militancies, and other negatives of modern day living, which tell on the health of us all. This COVID-19 pandemic is the mother of health surprises. That's what I call it, catching us all unprepared. By advocacy, we prepare to grow better health in spite of this, preventive and even curative. Health advocacy is health promotion and reduces the cost, both financial and human. If we are saying that people should ensure that they are thoroughly masked and keep the distances that they should keep, that individuals, employers, families, insurance companies, medical facilities, our communities, the state and the nation will spend reducing the cost on medical treatment. Good health also makes important contributions to social economic progress of any nation. Healthy populations live longer, are more productive, and save more to lead to economic prosperity. And I think that's where we are going as a nation. That's our dream. We all need to engage in health advocacy. It is not just for the health workers themselves or health experts. It is an all-encompassing call. All health advocates should align on the convergence of better health for all. All health advocates should also aim at working with demographics to include all and the rural populations. All systems have to be integrated for synergy and optimal functionality if we are to reach our SDG goals and leave no one behind. I think that essentially is what it is for us. This advocacy tool is here today for jeering hours for better health and repositioning the nation steps up on Global Health Index. We deserve better ranking than our status quo as it is. For us, as the International Society of Media in Public Health, ISMPH, we will continue to strive to serve in this direction, particularly using the media to achieve health program outcomes. We thank CORECA, that is the consortium, for entrusting ISMPH with the production of this advocacy tool, and assure you that we intend to disseminate very widely for great impact in realizing overall objectives of the CORECA project. I thank you all for listening, and I hope that together we'll be able to move health agenda forward in Nigeria. Thank you. And over to you.
Thank you, ma'am, and thank you, Mrs. Temuji, for that. The next on the agenda, because of time, I'm pleased to call on Professor Adebayo Fayoyi from Caleb University. He's a veteran. He has been doing this, and he's going to be giving us in depth, and he's going to be giving us the introduction into the advocacy toolkit. He's going to be giving us the review, telling us what actually is the crops and this. So, Fayoyi, Professor Fayoyi, over to you, please. Kindly unmute yourself, Professor.
Yes, okay, I'm unmuted. Thank you. Okay, now you can hear me. I've also just for a minute unmuted my video just so that you can see that I'm not a ghost. It's raining here, and so the broadband is very weak, so I will unmute my microphone. Let me also continue to stand on existing protocols. Your Highnesses that are present today, I bid you good greetings. government officials who are here, we thank you for being here. And the distinguished participants, as at this moment, we have 160. This is awesome. Issue interested in ensuring that we carry this touch forward. I thank you very much. And a surprise thanks and maybe an colleague and a senior brother in 1993. Mike JHU, when you were with, I think, a USAID, I was working with Susan Crane, and I left you to join UNICEF in 1993. It's nice to see you for the first time after all these years. Thank you very much. So protocol is done, so let me proceed with my presentation. The essence of this webinar is to, I need to disable screening. Please, can you enable me to show my screen? If not, host disable participant screen. Okay, I'll just continue. The essence of our meeting today is to look at the advocacy toolkit for
so, Prof, you'll be given the right to share your screen shortly.
Strengthening capacity for epidemic response and readiness. And so I will have a three-part conversation with us. It's going to be a maximum 10-15 minutes based on my brief with the coordinators. I'll look at advocacy in perspective, then I'll look at the toolkit, and I'll look at the toolkit plus. So we all know that advocacy is a strategic process, and I'm very happy that colleagues who have spoken have identified the fact that it is a strategic process to ensure that we have changes in policies, positions, and programs. So we know why we do that. We also know that it is a process through which words become actions and plans and programs are developed, necessary financial and human resources are made available for us to be able to see changes made. So we know what that is. We also, of course, know that advocacy is a deliberate process of influencing policy decisions when laws, regulations, resources, and decisions that affect individuals are being made. Overall, it helps to elicit public attitude to change influential groups relating to culture, norms, traditions, conventions, beliefs, behaviors, and practices that affect various populations. That is why it is important for us to look at the kit. I'm trying to situate the kit within the broader evidence around advocacy for us to be able to see how it effectively responds to the purpose for which it is made and how it takes us forward. Ultimately, it helps to achieve positive disposition of influential leaders and decision makers and persuading different publics and actors through multimedia tactics and influences. So that we know what advocacy is. Lessons that have been learned just as part of the capacity building component is that advocacy is not an end in itself. It's a means of social justice and social transformation, and that is part of what the kit is designed to achieve. We also know that politics plays a critical role in advocacy calculus, and I refer to the comment that was made that there was a whole lot of political negotiation as far as the COVID response was concerned when Mike Egbo was making his intervention. Strategic networking and partnership represents the mainstay of effective advocacy, and I think that is part of one of the reasons why we are here, to ensure that we are, as a collective, building capacity and having a common understanding of where we are with the response. And a couple more points is that evidence is a foremost technique and tool in influencing influentials. The advocacy key that we're talking about predicates its analysis on evidence. The voice of the affected population becomes a critical thing. And one of the things that we'll also be looking at as baseline for assessing the kit is to what extent is it looking at the voice of the people. And finally, noting that sometimes advocacy runs into some kind of and antagonistic dimension. Again, some comments that had been made earlier noted the fact that at some to be undertaken. So that is in perspective. Now is the whole pandemic. We know that early in the year when the pandemic came, it changed the entire trajectory of the world. The coronavirus affected all population groups and stuff like that. As at this morning, 38 million people plus have been identified 1 million countries and territories around the world. That is the scope of Africa just now. But just to note that the pandemic has challenged all ethnic and geopolitical identities across several development spectrums, affecting the developed, perhaps much more than the developing countries, crossing racial lines, crossing gender lines, crossing demographic groups, and not sparing any class, color, creed, community, leveling various identities at a global, continental, and national level. This is what we have seen with this pandemic. And that is why continuously thinking about how to advocate around it becomes very critical. It has also had tremendous psychological and epidemiological impact with fear, worry around the world, and at some point in Nigeria sometime. And the whole public health, mental dimension, the trauma, the loneliness, the depression, and substance abuse that it has generated has been very impactful. What about Africa? Of course, Africa has not seen the scale that many other countries have seen. Africa hasn't witnessed the level of impact that COVID has had in many various countries. And at some point, people are thinking of what use is this COVID thing in Africa. As at 2-3 days ago, the WHO had identified 5 main reasons why it has limited impact in Africa. And I'll come quickly after that to the undertaking. And again, going back to the point that was made by earlier speakers, a strong advocacy response was put in place to ensure that a speedy action was taken place, took place. So we thank you people for that. One of it is also public support. WHO says that there was tremendous public support across various groups to be able to help us achieve that. Third point raised is the youth population and the whole factor of fewer old age home groups that many other countries have seen. Number 4 is the favorable weather that played a critical role in this pandemic, and then the good community health systems that some countries have. So these 5 reasons have been adduced for the limited impact of the pandemic in Africa. However, it is noted that it is not time to relax. Despite the limited impact, we cannot relax. This is what the WHO Director for Africa said a couple of days ago. People in Africa cannot afford to relax. The slower spread of infection in the region means we expect the pandemic to continue to smother for some time with occasional flare-ups. So while we might not have had the scale and scope of the effect in Africa, according to WHO and other agencies, it is not time to relax. One other aspect of the pandemic that is relevant to our work is the whole misinformation, what WHO calls the infodemic. We have globally seen a tsunami of information and misinformation and disinformation around the pandemic. And this is critical for our advocacy work. We know that as early as June, there were over 4,000 global misinformation and hoaxes around it, and hundreds of thousands, by a couple of hundreds in Africa too. So this pandemic was spread, the misinformation on social media and stuff like that through citizenship journalism, public, the bloggers, the comedians, the jesters, the political leaders, and the religious leaders, all creating the context for us to understand advocacy and why the toolkit is important. Now to the toolkit. Of course, we know the toolkit is a joint effort, has been coordinated by the International Society of Media in Public Health with other partners. And I say it's a great job. Why do I say that? Number one, the toolkit offers and situates the work that is to be done around it within some gold standard in the understanding of advocacy, and I commend that. It articulates the rationale for COVID advocacy, recognizing that we had challenges with our preparedness and readiness, recognizing that there was challenges with the way the process of intervention was undertaken and that certain specific actions needed to be undertaken. So providing a clear-cut framework for undertaking COVID analysis, you will have it in the toolkit. The other aspect that is a major component of the toolkit is the national context for undertaking advocacy. Usually, we say that advocacy has to be context-based and issues-based, and this has been provided with a succinct, concise analysis of the national context that frames the intervention that needed to be taken, that outlines the outputs and the action that needed to be taken. So that is one of the other strengths of the toolkit. Another point that is I'm outlining in the toolkit is the fact that it provides a contextual basis for advocacy planning. It offers us a 7-point advocacy planning tool, which is critical in developing advocacy. For those of us who teach advocacy and we've been in advocacy planning processes for all these years, we always advise that any advocacy intervention must be based on solid processes or a toolkit. For us, there is 7-point analysis for us to be able to do this, starting with conducting analysis, undertaking stakeholder mapping, preparing advocacy messages and materials and resources, translating advocacy objectives into concrete activities and materials, developing and identifying the monitoring and evaluation component, and developing an work. So that you will find in the toolkit. A critical element of advocacy is the ask. And from this toolkit, we have 3 elements, 3 dimensions of ask. One is the need for inclusiveness, where claims, evidence, and arguments are provided for going forward in terms of the inclusive nature of COVID advocacy into a wider program. And that is linked to the integration. And I'm happy that we have the health sector coalition as part of this process. And the third ask is an alignment so that we ensure that all the various, I think one of the speakers said 130 civil society organizations are aligned in terms of their messaging, are aligned in terms of their direction, are aligned in terms of the results that they are trying to get. So the 3 asks represent a critical element of the toolkit, and it helps us to focus intervention as a group towards the right direction. 3 other things that I need to point around at the toolkit represent the top line messages. Many advocacy interventions come up with messages that are generic and woolly and waffling, but this comes up with a matrix of messages targeting specific audiences across at the national, at the state, and the local government level, specific messages targeting specific actions for specific individuals. And this is a strong point in the kit. The kit also identifies implementation plans through a set of monitoring tools, which helps advocates and the various civil society organizations to be able to monitor and measure themselves as they go on. And finally, it identifies appropriate broader strategies, including media engagement. And I'm happy we have several media organizations participating here. It talks about lobbying of various individuals and influencers, and we are happy our royal fathers and other technical people are here. Evidence and research constitutes a major element, and the tool makes the point that it has to undergird and underpin the advocacy efforts throughout. And finally, it talks about citizenship mobilization, which is part of why we are here. So that is a critical analysis of the kit. My reflection is I find it comprehensive to be able to that, because it looks at the various elements of advocacy, response and preparedness, and going forward. It is issue-based because it targets specific issues for specific individuals. It is user-friendly because it doesn't come up with a very academic approach to doing advocacy. And it is forward-looking in terms of a call to action actually beyond COVID. It inspires coalition with a sense of urgency for addressing critical health issues, and it motivates us to drive change for our health and well-being. My conclusion. I recognize the fact that addressing information crisis around epidemics and pandemic requires effective and consistent dissemination of information among various social groups. For those of us who worked in the days of HIV, when we're still there, we remember the whole challenge with information dissemination, engagement, and stuff like that. And even with Ebola, we remember how ineffective communication, lack of communication contributed to the problem. Therefore, the point we're making is, and as another person said, we don't know what is going to happen next. People are talking of pandemics and different kinds of effects. We don't know what will happen next. I believe this toolkit provides, although it is focusing on COVID, provides for us a clear understanding, a baseline for us to be able to do integrated advocacy, measured and integrated advocacy. It helps us to look forward and beyond COVID. We don't know how it's going to end. I know a lot of research is taking place and vaccine and all that, but critical for us to know that addressing information crises for epidemic and pandemics require effective and consistent information, and this is part of what the toolkit tries to do. It's also critical to know that driving change in the overall health and well-being of all of us requires integrated and innovative advocacy. Therefore, as we look and use and disseminate the toolkit, we need to continue now to look forward in terms of how to expand within the integrated health sector one reform, for us to be able to continue to do innovative advocacy. And finally, for me, is a strong and innovative advocacy. Effective advocacy is a remedy. I call it a vaccine against misinformation, disinformation, hoaxes, and mistrust that we always have. I call it a tool for insulating different levels of government and levels of influence in community groups around those health misinformation and disinformation for us to be able to take an effective action. And on this basis, I said, what more can we do? We are all here as advocates, committed to the cause of ensuring that we have well-being and welfare effectively ensured. A toolkit is being provided for us to be able to do this effectively very well. I think the minimum we can all do is to continue to join in the action, be an advocate for us to address the challenge that has been given to us by COVID within a broader health system, health reform process. Thank you very much.
Thank you, Professor Adebayo Fayoyi. I'm sure you agree, now we are becoming experts, strengthening our capacity to do better advocacy. That was really, really good. And I can tell you, this is it. Everyone, you can look at the screen. You can all see the advocacy toolkit. Yeah, it has, very beautifully made. You can see the color, and the content also is very, very captivating and is well detailed. The toolkit, many thanks to all of us that have been sending concerns them. Oh, how do we get it? Very, very certainly, the presentation by Professor Adebayo Fayoyi will be shared in our email. We are very sorry that it didn't get to share it on the screen. But if you have followed, you will see that it's still something because it came down to our level. So the toolkit will be shared in our email, so you can check your email you've used in registry. You will surely get this in it. And also the presentation will also be shared. And also the toolkit will be made available on on various platforms, websites. You will also have it available to download for your use. Thank you very much, and thank you, Professor. Because of time, we need to move on to the next agenda on the item on the agenda. And that is where we are going to be having various speakers sharing their technical expertise, feedback on the various use and impact of Advocacy Toolkit. The first set of speakers I'll be calling will be speaking to the impact of advocacy on emergency and health response in terms of COVID-19. And now it's my pleasure to call on Dr. Omobamile Rosemary Olowu. Like I earlier introduced her, she is the Director in charge of the Public-Private Partnership, the Diaspora Unit of Federal Ministry of Health. And also she is the Director in charge of Special Services within the FMOH. Dr. Omobamile Olowu will take us through the impact of advocacy in the perspective of the government. Thank you, and over to you, Dr. Bolanle, for the next 3, 4, maximum 5 minutes. Thank you.
Thank you very much. My Royal Highnesses, distinguished panelists of on this webinar.
Okay, Dr. Bolanle, it seems you have
to use two devices.
Yes, you need to
use devices because connection is not. My connection is not stable, so I may lose contact in the course of my speaking.
Okay, so what I would advise you to do, is that you connect one audio. So even if you have to switch, you just disconnect one audio so it doesn't put back. Thank you. Sorry, participants and all attendees for that. We are going to get through it in a few seconds.
I think I've taken one out, but it's still on in case this is the one I'm using now is off. Okay, I want to online the organizers of this webinar. Thank you very much, Auntie Moji, and the executive director ISMPH and other stakeholders online. I want to start by saying that the Federal Ministry of Health in general appreciates all the efforts of all stakeholders that have been working assiduously on this COVID-19 response. However, we would like to say that if not for the effort of the proactiveness of Lagos State Ministry of Health, I don't know what we'll be saying today. The impact of Lagos State when the COVID-19 pandemic broke is so phenomenal that I know they lashed on the experience they had during the Ebola virus that broke in the country. However, we want to appreciate Lagos State government for that initiative. The federal government and the other stakeholders have been working hard as well. Federal Ministry of Health, in collaboration with the National Center for Disease Control and the Presidential Taskforce, have also been doing a lot of work. So many pillars were created by the PDF to combat the COVID-19 pandemic. And the epidemic that started in Wuhan eventually became a pandemic. So many lives have been lost in Nigeria in particular. I'm happy and that in Africa, as the earlier speakers have said, we have been a bit lucky because if not that action were taken immediately, and I believe it's through advocacy that we are also trying to promote today, we would have been in a very terrible situation. I will say that the same advocacy is what was when the issue of Lagos, Kano State broke in the month of April, May, June. The federal government and the stakeholders, Dr. Dickin Mike and the other stakeholders, I appreciate your effort in coming together to push the federal government into taking immediate action to stem what will have been a disaster for the country. That is, I believe, is also what we'll call an impact on the response of citizens in Kano State. So many deaths are recorded and they claim it was from unknown cause. However, it was when it was interrogated that we discovered that COVID-19 was actually part of what was killing the people. And that was really a good action taken on behalf of federal government. In addressing COVID-19 virus, the pandemic, the whole society response is what I will advocate, and that is what I am seeing portrayed here. Here the media, the other health practitioners, the CSOs, the private sector are all coming together because also there is a COVID that have also come into action to help in fighting and provide isolation centers, drugs, and other things in addressing the issue of the pandemic or COVID-19 pandemic. The issue of Cross River State, because some of them are still in denial. We had to go through Cross River State. I led a delegation to Cross River State where they were still in denial that they didn't have COVID-19. But thank God we interrogated the actions taken by the state, and we found out that they were not actually conducted. So advocacy was what we took there, and to God be the glory, they have yielded, but we are still yet to record more tests done in that state. Kogi has refused to admit the federal government intervention, and I believe with the inauguration of this or launching of this toolkit, it will help us in gaining access in Kogi State, because they are still in denial. We still haven't gotten any report from there. I want to say that the issue of the advocacy on the emergency and health response as regards to COVID-19 is very apt, and the launching of this toolkit will say is also going to be very useful in addressing so many of the issues. There have been positive responses as regards the impact of advocacy on the health response and emergencies. The issue of the emergency transport, that is the ambulance services, became very strong at this time because it was really in comatose state in the country. Now we now have an ambulance service that was revitalized during this period. And I believe that is part of the impact that we have seen on COVID-19. And it's part of the response the federal government has introduced to improve, because without the ambulance service, we wouldn't have been able to transport the confined cases to isolation center treatment. And this could have resulted in more cases of COVID patients in the country. The issue of from primary healthcare development agency spoke about the response they have made, which I believe is also a positive, because when COVID-19 pandemic broke, many people were afraid to go into the health facilities. Even the professionals were very afraid to administer services to their
Okay, Dr. Bonala, you might wish to change your device now. We can't hear you. I think it's network. Okay.
Yeah, sorry, I lost my network. That's why I said I'm back on the other one. So we've had to, there is now an improvement in the antenatal care visits by women, pregnant women. There is increase in the health facility deliveries. Immunization has improved, and there is positive response to the reproductive, maternal, neonatal, and child health and elderly and nutrition in the country. The instances have improved because of the impact the primary healthcare has made in that area. We have also seen that many more laboratories are opened because of, we are not only relying on the private and public laboratories, we are now admitting and accrediting more private sector laboratories to help in the testing of cases that have the COVID virus. Sorry, I have to go. Okay. There are some also negative responses that I would like to highlight as well. In spite of all these efforts, many local governments
We've lost your audio.
Okay, with these toolkits, when it becomes operational, I believe there'll be more community-based advocacy will be upscaled, and many of these local government areas that have not been reporting or testing will come out and get more cases that will be arrested and treated in isolation centers or possibly in quarantine for the period they needed to be quarantined. And there'll be the transportation of samples will improve because we have issues with laboratory results and laboratory samples not being able to get to the laboratories early enough. Laboratory results will come out on time, and we'll have more citizens mobilized for testing. So the issue of this
okay.
I hope you can still hear me.
We can hear you, but we need to round up now on your session.
Okay.
Thank you.
Well, on a final note, I want to say thank you for inviting me to this webinar. I also advocate that we continue to have an inclusive response to this pandemic so that everybody will be on, hands will be on deck and will be able to improve the health of our citizens in the country. Thank you very much. Hello, can you hear me?
Yes, we can hear you. Many thanks.
Okay, I think I'm done.
So we'll quickly move on to the next person, the longest Commissioner of Health in Nigeria, a veteran change agent and advocate par excellence, Dr. Jide Idris from Lagos State. Dr. Jide, over to you, please, sir.
Can you hear me?
Yes, we can hear you. Proceed, sir.
May I extend my respects to Royal Highnesses, the various participants, and let me also express my appreciation to the organizers of this program for the invitation. This topic is an interesting topic. I found it very interesting for many reasons. One, if I could recollect what happened on the Ebola period, after the control of the Ebola, there was a conference organized by the National Academy of Science, where people gave experiences, their various experiences during the control activity. I remember precisely one presenter, a media man by name Declan. He said something that up to today still resonates with me, and that's what I've always taken along. And that is the fact that in the health sector, there is nothing we can do if we do not get the community involved. And how do we get the community involved is through advocacy. He said the stakeholders then did very well, but one thing they didn't do well was that they did not bring in the communicators, the media people, and that if we had got them together, give them the information we had on Ebola, perhaps again would have done that faster. And that made me start looking into things like advocacy. And I've come to believe, that advocacy plays a role in everything we do in the health sector. And just like the Professor Oyamoyi said, it involves so many things. The policymakers, and the people. Now, he said so many things, so I don't need to repeat that. But my take on this is that this toolkit is a step in the right direction, because at a point in time, I had felt that, like we all said, Nigeria was not prepared for COVID, just like many other countries. But the other issue I came with that we as a country to never learn from past experiences or lessons. And Ebola was a situation in point over which we could have built our infrastructure built on an experience, so that we would not have been caught hands down because by COVID. But very importantly, this is a step in the right direction, the development of this toolkit, which is good. And I want to commend the people who put all these things together. I commend you, and I look forward to having a copy of the toolkit. But what I'm supposed to talk about is the impact. Everybody has said this, so there's no point in repeating. But I'm looking at it from three major issues. What are the positive impacts for advocacy? Just like the professor said, some of these include the change in behavior, organizational practice of our people or of our systems. Did we get that done? I think we still have a long way to go, because we did not effectively change the behavior of our people by advocacy. And that's because I think our rule of communication was a bit different. We told people about hand washing, we told people about social distancing, but I'm not too sure if the people fully understood precisely what we wanted them to do. So I think it's through advocacy, doing the proper thing, is that we can influence, you can do this. The second level of impact is to influence policy, legislation, and decision making, especially with government. Have we done that effectively? Before COVID, I didn't think we were ready. A lot of policies that we need to put in place as a government, because like people have said, it is COVID now. It was Ebola 4 years ago. We don't know what will come out next. And so it's in our favor for us to look at government, meet with government with a way to change policy decisions, legislations with respect to a lot of things and decision making. Do we understand emergency or pandemic? If you go back to the issue of the emergency cycle that people normally talk about, do we fully understand that cycle? That cycle involves the issue of mitigation. These are things we do before the emergency happens as a way of preventing this from happening or protecting our people. The next level is preparedness. Were we really prepared? Are we prepared for any emergencies? Yes, I think from 2019 up to now, we've made a lot of progress, but we still need to make more. In the issue of response, when this COVID started, we were just responding haphazardly, like most people have said, because there was no clear-cut plan. And those plans are developed based on our analysis of threats, just like you say, analysis of threats, and what developing plans again to counter those threats. How do we communicate that? That's the essence of advocacy. What are the threats in the environment? COVID is one, but it's just one out of many. In this country, we still have infectious diseases killing our people. We have the concept of biosecurity. Do we know that? Imagine and reimagine infectious diseases. These are diseases we need to plan for. And in this environment, we have all the factors that actually make us very vulnerable. So policies and laws are developed around our analysis of these factors. If you can do that effectively, then we might be able to actually influence influence the impact of some of these. And what are these factors in the environment? I've mentioned the issue of legislation. A lot of our health legislations are very, very old. They need to be upgraded. One of the speakers mentioned the issue of a global health index, where they analyze a lot of countries and actually scored our country. One of the major areas where we scored was our health system. The other area was about how do we communicate with people? How do we integrate people? Integrate with people to ensure inclusiveness. Our human resources, these are issues that we need to address for us to be able to respond properly. You saw the problem we had with the health workers. We expect these health workers to be the forefront of this fight, but again, they lack protection. They lacked part of the understanding. They are not properly motivated. So we started again putting up all these structures immediately. Just like we had no plans effectively again to address this issue. Our issue of medical countermeasures, PPEs, all the diagnostic facilities, we were not ready for most of this, and that's why again our response time was a bit low. But I'm glad that at least this group, International Society for Media for Public Health, have taken this the bull by the horn. They produced this kit. It's the right step in the right direction, and for which we can build upon later. And so I would say that I will congratulate you. Love to see, I look forward to having a copy of this toolkit. And perhaps again, it's going to spur all of us again into coming together, addressing health issues. Like somebody said, health is everybody's business. Health is everybody's business. And the question I always raise again is that, is our system geared to making people healthy or making people sick? These are questions to ask. And to me, prevention comes first. And in preparing for prevention, a lot of this is advocacy is a major issue preparing for prevention. Every single thing we've always done requires communications, even right from mitigation aspect of it, preparedness after that, even response again, require communications, effectively communicate with government, with the people. And we need to change the mindset of people, and this is where advocacy is key. So on the last note, I want to commend the organizers of this program for this initiative. Like I said, I look forward to having a copy of this, and I think this is not the end. We need to build more on what we've just started. I thank you.
Thank you, Dr. Jude Idris, and thank you for keeping to time. And we surely and definitely look forward to taking this forward. The Advocacy Toolkit, once again, will be shared to everyone on this meeting. And we're also going to be sharing the recordings from this meeting with all of us. And we're also happy to tell us that today we have with us our brothers and sisters from other African countries. Mainly, we have someone joining us from Tanzania. You're welcome. We are pleased to have you. Before we go to the Q&A session and the second segment of this impacts and listening to our royal fathers, it's our pleasure to also have a 1 minute flash talk on impacts of advocacy on the COVID-19 response from the #1 commissioner in Nigeria. That's the chairperson of the Commissioners of Health Forum, Dr. Betta Edu, the Commissioner of Health from Cross River. Dr. Betta Edu, please, can we have your 1 minute spot on this impact of advocacy on COVID-19? Thank you. Thank you, Dr. Betta. Are you on? Dr. Betta, can we have you? It seems, okay, your audio is on, but we can't have your voice. But can you actually have your spot on 1 minute talk on the impact of advocacy? Okay.
I think the vote. Hello, can you hear me?
Yes, I can hear you now. Please proceed.
Sorry, just so thank you very much for this meeting, and indeed all the contributions that have been made earlier on, and the key messages have been noted, and it's very helpful for our country going forward vis-a-vis strengthening the entire health system. As it concerns advocacy, I think advocacy is required at all levels, both from the national all the way to the grassroots, to effectively be able to tackle public or manage public health response in Nigeria, especially build capacity for an proper endemic health response. Basically, for states, various states, we need to be able to get the political will, the right political will and resources for this response. And so we have to start from that level where we advocate to our principals, governors, key stakeholders at state level, at the national, of course, advocacy to the right sources and the right persons who are key stakeholders in the implementation of a public health response, an appropriate public health response. Of course, this will include both from the presidency to the traditional rulers across the nation. Hello? The traditional rulers, traditional rulers across the various states. Of course, the religious leaders should not be left behind. The private sector, we need to advocate to them on ways that they can effectively support a response, a public health response. And then at the state level too, working with these same people in our various states, all the key stakeholders to get their buy-in, or the MDAs that have some form of direct or indirect relationship with a pandemic response. We also need full advocacy to the health workers union, their regulatory bodies, such that they can work together with government, the public health sector, to achieve more results. Advocacy too has to be done at the community level, to get the people to buy into whatever response we're doing, because remember, there's the demand and then there's the supply side. And so for us to be able to achieve proper results, we need to advocate to them at that level to also buy in. It's important for people, for us in the system, especially in the public system, to advocate to the general public on where we're headed, what we want to achieve, and make this as clear as possible in simple terms so people can appreciate where we want to go and how we want to get there. That way they key into our visions and help us carry out a proper response. In all, the idea is to ensure that everybody plays their part and their role to see that whatever response that is being put on the front burner is successful. So really, we need to build capacity of those in the Ministry of Health, those in the Primary Healthcare Development Agency and other health agencies. We need to build their capacity, conduct trainings for them. Even health workers at the front line, we need to build their capacity to advocate, because advocacy, it's a long spectrum from those at the top all the way right to the bottom. And it's not just some particular people who are expected to do it. Everybody at every point can be involved in advocacy. Thank you.
Thank you, Dr. Beta, for that. And definitely everyone, we have the capacity built, and we will continue to carry out advocacy. So the second segment of the last segment before we go to Q&A, please, if you have Q&A, you can see that people have their hands raised. We will come to you. Can you drop your question in the chat room or the Q&A, and we will surely take it. Engaging international institutions for advocacy on emergency and health response. Engaging international institutions for advocacy on emergency and health response. And the first one that I'll be calling on among our royal fathers is Royal Highness Alhaji Dr. Aliru Yaya, the Emir of Shonga. Shonga is in Kwara State, for those of us that might not know. And he has been an advocate, and he was the first executive chairman of Health Reform Foundation of Nigeria. And so we are always pleased to have him. My honor to call on you, Your Royal Highness, for your 2-minute conversation on how the international institutions can continue to use advocacy to management around COVID-19 and other health emergencies. Thank you, Your Highness. And over to you. Your Highness, we can't hear you, but I know you are speaking. Your Highness.
Well, Mr. Chairman, that's Mike.
Okay. We can hear you now.
Yeah, okay, fine.
And we can see your face. Thank you.
Yeah, Mr. Chairman, That's Mike, the Nomad, and all the distinguished people that have spoken before me. Mine is just to say one word. I'm happy that you keep recognizing the role of the traditional religious institution in advocacy and also even in implementation. Advocacy has many roles in health. It brings influence to serve, influence and expertise to serve in our communities. It ensures inclusion of needs and voices in the political and policy process. It works with being served to determine and understand the community's needs. Determines community needs.
Your Highness, we
Can you hear me?
You are back. We can hear you now.
Well, yeah, go ahead. It's a great tool. It helps to mobilize our people, transformation of our health and lives of our people, and therefore no one is left behind. It's a great tool from the way it's been analyzed, a good segment, audience segmentation. So on and so forth. I still forward to its application for the support. Thank you. Can you hear me?
Yes, I
endorse the toolkit wholeheartedly.
Thank you. I will believe that our followers will also use the ticket, sir.
Okay, I appreciate that. Thank you. To it. Well done.
Thank you so much, Your Royal Highness. We are most honored. So the next person on to call on among our royal audience that will be telling us how the traditional institutes or institutions will be engaging and strengthening advocacy to strengthen for the purpose of health emergency. It is Royal Highness Oba Kayode Adenekon Afolabi, the Atoyebi II and the Alakomu of Akomuland in Osun State. He is a veteran journalist and is also an advocate. So we are happy to have you. Your Royal Highness Oba Kayode Adenekon Afolabi. Over to you, please. Royal Highness, can you unmute yourself? Oba Kayode Adenekon. Okay, I think we are trying to get him on. But while we go on, and we are trying to get His Royal Highness to actually have his audio turned on and unmuted, I will go to the questions and answers. And many times, please, we have all of you. I can see everyone that are raising their hands up. We have Oluwatosi Kuti, Oluwafeyikemi Agbola, Kabiru Dakata, Ahmad Asalam, Isaac Ahmad, Comfort Agada, Abdul Karim, Aruna, and the rest. So what I'm going to request you all to do is to please drop your questions in the Q&A. We are going to take almost everything. And just sorry, we actually said this was going to be for 90 minutes, but yes, but we just want to get and make it participatory as much as possible. And I'll be directing the question to some of the panelists, ranging from Dickie Mike, Chief Mrs. Mojima Konjola, to the Professor Kayode, and the other speakers that have actually been engaging us. So the first question that we have here is, can we have a copy of this toolkit? Very yes, you will be having a copy of the toolkit. And as I said earlier, the toolkit will be shared. Some copy of the toolkit will be shared to your emails, and also along with the recording. We're also going to share with you the link that you can use to download the toolkit from our website, from the ISMPH website and HSRC link. Thank you. The second question I have is, what strategy is in place to work with CSOs working in hand to reach the rural communities in Nigeria in creating awareness and sustaining social distance in the use of face masks, washing of hands with running water. We also have, will the toolkit be mass produced for members of the public? Okay, yes, we're going to have a soft copy, so every public member or citizen of the public can always have access to it virtually, and you can download it and use accordingly. We know that because of the issue of limited use of contact surfaces, that is why we might not be going into mass production, but we have the hard copy. This is a hard copy. Yes, we have the hard copy, which will be shared across board to some the stakeholders in the community. But everybody will have access to a soft copy. Thank you. And the next question is, health advocacy should be geared towards evidence-based approach. Advocacy on the issue of justice administration. Yes, very well. Health advocacy should be geared towards, and it should be evidence-based. This question will be anchored by Chief Mrs. Mojima Konjola and Dickie Mike. How do we address the less concerned attitude of our government towards the decaying health systems in Nigeria? Dickie Mike, please, you will be anchoring these questions in terms of how do we address the less concerned, the attitude of the government? How do we actually help the government to enhance their? And Dr. Bola Olowo, please, I would like to have your take on these two. The last for this area of questions that I'll be asking is, how can the policymakers see the media working to bring to their attention their feelings of not seeing, or attention, their pains of not seeing as opposition but as partners in progress. So I think the question is talking about how the government see that media practitioners are not seen as opposition, rather as partners. And I think we have on respondent that will take this with us. So let me first go to Dickie Mike Ego to give us his takes on the question. Dickie Mike, please, can you unmute yourself and respond to some of the questions that we have?
You gave so many questions. Which of them do you want me to respond to first? The last one I remember.
Strategy in place to work with civil society, working hard to reach rural communities in Nigeria. What strategies do we have to civil society needs to take on to reach out to rural areas?
Okay, thank you very much. I think it's a straightforward question. We must recognize that in the rural areas, we have community-based organizations, we have civil society organizations, we have the National Orientation Agency that have offices down to the ward level. And so we're connecting, they are members of this group, which is why HSRC is well positioned to be a champion for change in terms of connecting with the rural areas. And I think that is the skill, that is the experience that we bring on board. So we'll be working with various community-based organizations, working with government. That's the strategy that we have. So we have members of HSRC living in these areas. So it's a straightforward thing. Second question.
All right, thank you, Dickie Mike. So the next question I will post it to Dr. Emmanuel Supo, is health advocacy should be shared towards evidence-based. How do we ensure that citizens and public health approaches are actually effective in advocacy? So it's asking, how do we actually ensure and broaden the broad base for evidence-based advocacy? Dr. Emmanuel Supo, please. Thank you.
Thank you. I think evidence, as the name implies, trying to get information and concrete, facts as to why you act. And the basic way of getting evidence, especially at the community level, is engaging them, trying to find out their perspective, trying to look at what issues exist, and then collating those into concrete facts and formulating appropriate communication mechanisms and channels on which those informations can then be used to advocate either upwards, that to policymakers, influencers, or at the community level in terms of how they can actually, change their behavior and, appropriately, act the right way. For example, the issue of hand washing, you talk about it, but if you don't engage the people to understand why they are behaving the way they are doing and what needs to be done, you may just be putting it on the media and not actually getting the evidence that will enable them to change their behavior positively to what you want. Thank you.
Okay, thank you, Dr. Emmanuel. I'll quickly go back to Vicky Mike. And you have a question that talks about how do we address the less concern or the attitude of government towards the decaying health system in Nigeria? Just a minute, sir. How do we actually address, how do we help the government to improve on this, their concern to health system strengthening? Vicky Mike, over to you.
Well, we have been in this business, like I said earlier on in my talk, by advocating, by fighting, and making sure that we hold government accountable. It's a tough thing. It's trying to get government to understand the importance of health. And I think COVID-19 has actually brought it out that when it comes to health, we're all equal, because it impacted on everybody. So we hope that the lessons we've learned here will help us, because this is what we do for a living, trying to get government to understand. We beg them to put budget, we beg them to approve plans and all that. So we continue to advocate, but we need everybody. It had to be everybody's business. Yeah, it's our collective responsibility. So we're doing that and we'll continue to do that. That's why you have Royal Highnesses with us today. That's why you have commissioners with us today on this platform. My friend Professor is here with us on this platform. So this is the way we try to galvanize support to government. We're actually watchdog for government. But our own dog is small because the government is an elephant. We have to work hard to. A dog knows you can bite the elephant, it still stands. So we're doing our best. That's all I can say. But we need support of everybody. Thank you.
Thank you. Thank you so much. And also, I will have from Damilola Oshinowo, and this question I'll be actually targeting it at Dr. Bola Olowu. And it says, favorable weather has helped Africa a lot, but soonest Harmattan will strike across the West African states. How accessible is it? We'll be testing kits, and we are okay. He said, how accessible is the Advocacy Toolkit? As I mentioned that we're closer to the time than ever. I think this should be implemented sooner. Yes, we are going to be implementing, but the part of the question that comes to you, Dr. Olowu, he's asking only 560,000 out of 127 million Nigerians thereabout have been tested over the last 6 months. Till when will the testing be made readily available? So what are the plans of the government to improve on testing? And then also we have questions to you, Dr. Bola Olowu, and this person is asking, do we have any legislation with regards to observation of COVID-19 protocols in Nigeria? Over to Dr. Bola Olowu, please.
Okay, thank you very much for those questions. With regards to how the government is going to improve the testing, I would like to say that with this advocacy tool, I think it will also help mobilize our citizens to come out for testing. Many of them are living in denial. Many of them believe that there is no COVID. Maybe government is just using it as a funding gimmick. So with this advocacy and more inclusiveness in approach to the way we are getting to the citizens, because we have to carry the community along, I think we will be able to address this testing issue. On the issue of, the second question was on the issue of, please, can you remind me the second question again?
Okay, so second question is about how do we have any law or any legislative process on the...
Unfortunately, there is no law. We believe that your health is in your hands, but federal government keeps advocating and telling and giving a lot of advice, especially as it relates to NCDC on these non-pharmaceutical devices that should be protective devices that should be used and worn. I believe this should be enough to help the citizens understand that your health, that is even why the lockdown was eased. And the comment made by the SGF, who is the chairman of the PTF, said, we are easing the lockdown. Now your health is in your hands. The only thing government can do is tell you what to do, how to do it, but it is now left for you to keep your health and keep it safe and keep it safe for others. There is a jingle going on in the media in which the MTN, I think, say, wear the mask for me so that I can wear it for you. That is part of what we're also trying to also advocate. And with this tool, I hope it will help our citizens to understand that there is little government can do in enforcing this thing. There is no law, unfortunately, but we believe with continuous advocacy and training and capacity improve strengthening, all this will be a thing of the past. Thank you very much.
Thank you, Dr. Bololu. And now I'll be calling on Mrs. Mojima Konjola to respond to some questions for all. And he said, how can the policymakers see the media working to bring to their attention their plans, not bring to their attention the workings of the media and not seen as opposition, but rather as partners. So how can the media work effectively with the government? Now, the second part of the question that is going to media later, that how can the media address the challenges of language barrier in rural community when it comes to advocacy? Thank you, Chief Mrs. Mujima Konjola, please.
Thank you, Anu. Can you hear me? Can you hear me?
Yes, we can hear you clearly.
Okay. Yeah, first.
Yes, we can hear you.
Thank you very much. For us at ISMPH, we have always said that the media is strategic to public health in every way, in every ramification. And I always would advise and advocate that beyond reporting, we should also investigate. The Nigerian journalists, particularly health correspondents, have a role to play in this. And I would like to appeal also to managers, gatekeepers, owners of media, that until we all agree that the media is an integral part of development. The media, it's important to the health outcomes, then we might not be able to get to the promised land as quickly as possible. A lot of us, even our Fulani brothers, going from one bush to the other, they have their radios on. In fact, they're very alive to communication. And so it is important for us as media practitioners to ensure that we know so that we can report from the point of knowledge and be an advocate. And I know that a lot of media houses are constrained because of funds, and some have gone partially commercial, but I don't think we can compromise on health. And so I'd like again to use this medium to say that health should be given the priority it deserves. It should not be at the third segment of the news. COVID-19 has brought everything to fore, that without a healthy herd of people, we cannot move on in whatever development plans we have. Even the developed world is suffering this. So about us that are still struggling with a lot of poor health indices. So the media has a role to play. Now, as ISMPH also, we are advocating for using local languages to advance advocacy, to advance health messages. It is important. Thank God, particularly with radio, there are a lot of radios that are, in local languages. And thank God we have also some TV stations, social media, and all this. But then again, we all must report from the point of knowledge. We cannot assume to be doctor or nurses. We have experts that we need to go to. And you see, when we report and our reports are impactful, then government and any institution will have no choice but to work with the media. The media, we are said to be the fourth estate of the realm, but we are that important. And until, of course, ourselves fail ourselves to enlighten ourselves so that we can report as knowledgeable people. And we're not just sitting as event, we won't just cover only events, but we'll be investigative enough. At the beginning of the pandemic, we threw some questions out. You want people to constantly wash their hands. Do we have water? I would like my colleagues to go to the rural areas. What is the state of safe water that will engender some measure of sanitation? When we say wear mask, can we really afford mask? And even if you can afford it, are people wearing it right? You have people having it on their jaws, some people having it on their forehead, depends on how much of education have we been able to reel out? It is not so much for the health practitioners, but it is us who knows the language to communicate to people so that they can adhere to the COVID-19 protocols. And I think going forward, for us as ISMPH, we are going to be engaging more and more journalists. We are going to send in the toolkits to as many as we have media houses that will accept us. And we are happy that for all times, I can speak for NTA, and NTA is covering as I speak, and Nigerian television has always embraced the need to have reporters who would report from the point of knowledge on the health desk. That I know, and I know several other media houses are also embracing this. But more than anything else, we need to start breaking it down in our local languages. We need to speak to our people in the language they would understand, and going forward, we'll be able to beat not just COVID-19, but other health indicators that is ravaging or causing unnecessary deaths. I hope I've been able to answer this, Anu, and we would be available at all times to be able to pick on and speak and work with media practitioners across the country. Thank you.
Thank you so much, Mrs. Mujima Konjola, for that explicit response. And I'm sure that all our media respondents or partners online are taking note. All right, then ISMPH is always going to be available to support us. The last one, I know we actually beyond schedule. We said this was meant for 90 minutes, and we are 30 minutes into our time. But I'm going to just take the last two questions. If I'm not able to take your questions, we will be responding to them. You will surely get a response to them when we are sending out our recording. So look out for the responses. We are not able to take all the questions that we have. We still have questions coming in. We cannot take everything. But I'm going to take one that is very strategic in terms of coming from Alassane Koubes, and he's talking about how can we address issues around politicizing health emergencies, especially at the national and subnational level. I'm thinking, Mike, you be honored, will I have the honor to please respond to this? That how do we reduce and improve on the political economics for health emergency? What do we need to do differently, and how should we do it? Dickie, Mike, please.
All right, thank you. I was trying to unmute myself. Well, how do we, I support politicizing health. Health must be in the front burner of political agenda. The question is, who is driving that political agenda? And so I think what we need to do is to make sure that everywhere we go, I watched the state, the National Assembly the other time debating and grilling the Minister for Health. Oh, have you paid this? Have you paid that? You know, this is National Assembly that has also not been very active in promoting health as far as I'm concerned. This is my personal opinion. But because COVID was taking the lives of important persons in society, and it was getting to everybody, it became important. Health should be something that we politicize. It should be something that we use. We got the market women to march to the National Assembly because we convinced them on their role, because they never saw themselves as being important in health delivery. That's why we got the market women, over 5,000, to go to the national, because they got convinced that they are the mothers that would die in the hospital without the right facility. It's their daughters that would die, it's their children that would die. So we must make sure that everybody, the bike riders, the professors, everybody, Nollywood, that they see health as something. Number one, without health, you're nothing, because all of a sudden, even if you're a trillionaire, you have everything. Listen to what Steve Jobs said. I think people should go and read his statement when he was dying. He had everything, but now he was faced with death, and finally he died. So I think it's important that we make health a priority. Health of a nation is the wealth of a nation.
Thank you so much. Thank you so much, Dickie Mike. So the last question for the day, before we call on closing remarks, then we end the day. I was actually targeting Dr. Emmanuel Soko to answer this. It's about returning accountability. And Oluyemi is asking, how do we strengthen accountability, and what are the mechanisms in place to track the update and implementation? You know, not only of this advocacy drive, but all other interventions and response. How do we recognize the achievement, lessons learned, and address the challenges along the way? So it's asking about accountability. How do we keep track, and how do we learn from the past into the future? And while recognizing that we've learned Ebola came, but you know, how well are we able to integrate the issue of Ebola in the response of COVID-19? Thank you, and over to you, Dr.
Okay, thank you. Yeah, accountability, but then simply defined means holding people to account. And how do you hold people to account? That's agreeing on what needs to be done and who does it and when it's supposed to be done, and then going back to check whether that has been done. We have health plans, we have targets set and all that. The issue is, do we have a system to actually go back and check whether that has been done, the results have been achieved or have not been achieved, and they have not, why, and what needs to be done? Still trying to get back to my first list of evidence. So most of the times, we have annual work plans by states, by federal government, by organizations, and even by civil society organizations. But there are no opportunities set to actually go back and review what has happened by various stakeholders. As civil society organization, it's our mandate to ensure that we hold government to account and we hold ourselves to account by saying, let's see what you promised to do. You, the politicians, you, the technocrats, and even you, the civil society organizations, and then ensuring that the people that are mandated, you know, to actually go and review those processes, you know, actually and results, actually go out and review and see what has happened and then publicize. That's why the media comes in. When you now know that at a point, there's a point that is going to, you are going to give account, and that account is not going to be swept under the carpet, it's going to be publicized, then you have to sit up. I think some years back, you know, during the Obasanjo regime, there was a broad framework for accountability by ministers and all that. And to some level, it started and then disappeared. I think starting from that level right down to the grassroots, even at the facility level, primary healthcare centers, you know, where communities hold service providers to account and vice versa, provides a platform for ensuring that a sound accountability system is set in place to actually deliver, you know, on the results. And accountability is what drives results. If you don't hold people to account, then things go anyway, and they know that nobody is going to, you know, ask them key questions or, you know, either name or shame, and things remain the way they are. Thank you.
Thank you, Dr. Emmanuel. Thank you for that. And all our participants and attendees at these meetings, we are very sorry that we might not be able to go beyond this. I know the questions are keep tripping in, and we are not able to have all the panelists to respond to one question or the other. But we will share the feedback from them, and we will communicate and share feedback with the attendees. We already see all your questions, and we will definitely respond to them. And on behalf of HERFON, HSRC, I just say this, that it's not a must, we'll be working with CSO that are members of the HSRC, and we are going to be still extending our tentacles and partnership to other CSO that are not members of the coalition. But we look forward to having you being part of the coalition to make a better collaborative effort and response to this whole pandemic issues. And that note, I would love to call on Chief Mrs. Mojima Konjola to give our closing remarks and vote of thanks.
Thank you very much, Anu. Can you hear me?
Yes, we can hear you, please.
Well, you can see that I have to don my mask because we couldn't have done this alone. I couldn't have done it alone. I have some members of my team here, Bumi, BTB, Polu, all of you here that are here with me. I want to thank you. These are just some members of ISMPH that have been that have been able to put this together. However, I'd like to mention some names, and it's important for me. Deacon Mike, thank you very much. I know that it's very early with you there, but you have always shown commitment, and thank you that you haven't given up, because when we started and all those days that we have to be in the trenches and going to hard to reach areas with advocacy, you have always been a good shepherd. I'd also like, please, to recognize that we want to thank Dr. Isa of CHESTRAD, Dr. Sobo, who actually led the consortium. We want to thank you very much for your time. I also would like to thank very much, profoundly, Professor Adebayo Fayoyi. We've been together for so long, and his commitment for this country, he left, so to say, the green pastures to come back home to serve Nigeria. I have to thank Professor Oladapo Ladipo. He's away in London and he's hooked on, and he has always believed that the media can do so much. Thank you very much. And all health advocates that are hooked up, I am eternally grateful. Now, how can we do it without our royal fathers? I am a proud Kwaran, and the Emir of Shunga is from Kwara, and he has always been in the forefront of the battle for improved health indicators in Nigeria. My Royal Highness, I am grateful, Bagadoji. The Lord will continue to keep you for us. Unfortunately, His Royal Highness of Kayode, the Alapomo of Opomo, could not come on, but you can see that we just didn't hear his voice. He will send us his text of what he was going to say and would share this to all of you. Kabiesi, may your reign bring peace and good health to Akpomo in every way. Thank you very much. And my regards to Olori, who is also an advocate and a member and a family member of ISMPH. Now, how can I thank the participants? I saw a brother from Tanzania. I saw people from all over the place. I even saw people living with disability who also joined in. I can say to you that collectively, all of us would fight the battle to improve healthcare in Nigeria. I want to thank you for finding time to be here today as system change agents. Virtual meetings are in profusion these days. For you to find time to be here today means a lot to us. And more than anything else, I want to thank Dr. Bola Olowu. She was here from the very beginning. Dr. Jide Idris, I call him Commissioner of Commissioners. Thank you for your time. Now, Dr. Betta Edu, we only saw 2 days back, and I said to her, listen, we have this webinar on advocacy tool. And she said, sign me on. Thank you, that is the spirit, the I can do spirit that we need to march forward to improve healthcare delivery in Nigeria. But seriously, thank the coalition, but seriously, we couldn't have done it without the support of MacArthur. And so again, Dr. Shetty, Kole, wherever you are, and your wonderful dynamic team, we thank you for always putting the right foot forward in terms of developing and accelerating development in Nigeria. You have always been there as the backbone to support us to do more than we are doing. Thank you so much, MacArthur. God bless your work. Now, today is special. It's special for Anu. Anu wrote to me, we decided to bring her on as our anchor. It's her birthday today. Can we please say happy birthday, Anu? Happy birthday, Anu. May you continue to grow in strength and wisdom as, oh yes, it's a very happy day. Well, we're going to have, unfortunately, I can't have everyone on, but we're organizing a special breakfast for Anu, or we call it brunch. And we hope that this will be our further commitment to improving healthcare delivery service in Nigeria. So on behalf of ISMPH, I can say to you that we ain't started yet. Advocacy is so important, it's so germane to all that we are doing, and we will continue to do it together. We can't do it alone, like Mike Ego will always say, together we'll make it stronger, and it's inclusive of everyone, not leaving anyone behind. I can assure you, you will get all the copies, e-copies, a few moments after we close down, we shut down on this, and of course, all presentation. And we will ensure that you have a link to all the resource persons that have featured here today. Thank you for speaking true to power, for speaking true to power, and for being who you are, and that together we will continue. I know before I answer the last call, there'll be an improved health service in Nigeria, and I know you share the dream and aspirations with me.
Amen.
Thank you all. Thank you for your time. God bless you. Have a wonderful day wherever you are in the world. And together, let's give it up to Nigeria, to Africa, that indeed we will have better health indicators, God helping us. Thank you all. I take my leave. Wear your mask, stay safe, wash your hands. It's important so that together we can fight COVID-19. Thank you.
Thank you very much. Anu, happy birthday.
Thank you. Thank you very much. Okay, Mike.
On this note, we shall be ending the event. See you again another day. Bye, and thank you all for your birthday wishes.
Anu. When you get back to your office, please respond to my mail.
Yes, sir.
Thank you. Dr. Isa.
And happy birthday. Thank you. Thank you, Madam.
Good morning.
Thank you, Madam. God bless you.
God bless you too. Thank you for coming.
Thank you.
It meant a lot to me. Yes.
Bayo left.
Yes, Bayo has left. Yes, because it's raining. It's raining where he is, so he's not been able to. Yes.
Yeah, thank you, Modusa.
Honorable Commissioner,
how are you? Hey, Eunice, want to thank the National Primary Healthcare Development Agency. I'm sorry. Thank you all so very much. Eunice, thank you.
Thank you, it's my pleasure. It's my pleasure.
Better, how are you?
Honorable Commissioner, yes. Thank you. Thank you so much. You are all so dynamic.
Thank you very much.
God bless you.
Dr. Isa, good morning, good days. Nice seeing you virtually. Nice seeing you virtually. I'm fine, my brother.
And thank God and congratulations for this extension. No.
Thank you.
Eunice.
Yeah, my sister.
Dynamo.
Thank you.
On spot as always. God bless you.
Great outfit.
I'll send copies to your office.
Okay.
Or you'll get your e-copy almost immediately. Yes.
Okay, great. That will be fine. Okay,
I'll bring copies to your office. I'll let you know so that we can make noise, with that as well.
Okay, thank you.
God bless.
Thank you.
Dr. Jide Idris, I think he has gone.
Dr. Mike.
Dr. Bola Olowu, my sister for always.
Thank you.
Thank you. Oga Mike, What is this one that you are looking young? Who gave you permission?
God, challenge God.
Okay, I can't dispute it. Thank you very much for your time.
Okay, I think I can go sleep now.
Go and sleep, yes. Enjoy and have good. Have your
Jide,
coffee
thank
after.
you.
Thank you all.
Nice meeting you again virtually. Thank you. God bless you, Dr. Jide.
God
Nice
bless you all.
listening to you once more. Thank you, sir.
Oh, thank you. His Royal Highnesses, my burger doji.
Oh, how are you?
Thank you so
Yes,
much,
fine,
sir. Dr. Jide,
How are you?
you can't give up on us, so iṣẹ́ ìpọ̀tà máa ṣe o. Iṣẹ́ pọ̀ o. Thank you, sir, for speaking truth to power as always. God bless you, sir.
My pleasure.
Thank you. We'll send.
Thank you, sir. Your Highness, sir. Thank you, sir. Your Highness.
Your Royal Highness.
Your Highness.
How are you, sir?
His audio is
I'm coming, don't worry.
His audio is reconnecting.
Dr. Idris, I'm coming, don't worry.